research institution at NIH, so I can understand your concern, but the doors are not closed to other candidates. You can be assured of that, sir.
Congressman, from FDA's perspective, the doors are open there as well. We're working with multiple different sponsors, pharmaceutical companies, as well as Operation Warp Speed. We will look at all data that comes across the door. We will provide technical assistance to all who want to develop a vaccine and therapeutics.
Thank you.
Thank you. Mr. Griffith?
Thank you very much, Mr. Chairman. I greatly appreciate it. Dr. Fauci and then Dr. Redfield, I'm going to put you all a little bit on the spot because I want to talk concerned about what's happening in the schools. And Dr. Fauci, you earlier made some statements which led me to believe that you believe that not only nationally, but even within a state the size of Virginia, we probably ought to be looking regionally and maybe even locally as to how we do it and how we go forward. Did I understand that correctly?
You understood me correctly, Congressman, and that's the point I want to make because it's really a source of confusion. It's not one size fits all. I think you have to look at it at the local level, the county level, the regional level, the city level, the state level. So we often say, in America, should you or should you not be open? I mean, that's almost the non-question because we're such a large country and so heterogeneous and such a range of involvement of this virus in different parts of the country.
And Dr. Redfield, I'll move to you because in the Commonwealth of Virginia, they often are citing for various things related to schools and others, they cite the CDC. Do you agree with Dr. Fauci and his assessment?
Yes, it needs to be a very targeted jurisdictional decision.
And I greatly appreciate that because my district is 4 hours from D.C., even though people often think I'm right next door. And then the district stretches from the very edge of it, which is 4 hours away, another 4.5 hours, so that it ends up going further west than Detroit, Michigan, and the district, just my district, is larger than the state of New Jersey. So even within the district, we may need to have some additional regional approaches. Would you all agree with that?
Yes.
And Dr. Fauci indicates that as well. All right, Commissioner Hahn, in a statement on March 30th, 2020, you recognized the importance of facilitating access to viral samples in order to speed up the development of tests. You noted that in the future, making viral samples available earlier to commercial developers will be crucial to deploying tests quickly. This certainly will not be the last time we face rapidly spreading virus, especially inactivated viral samples, be improved in the future for quicker access.
Congressman, thank you for that question, and I think that is one of the lessons learned from this situation with COVID-19 is that access to those samples is very important. We would work with NIH, with academics, with the CDC to make sure that those are available. And just to make a point, we, for serology tests, have made a reference panel now available to developers to actually facilitate that. That's an example of what U.S. government, FDA, NIH, and CDC could do.
I thank you, and I apologize. Admiral Giroir, did I say it close to correct?
Or that's good enough.
All right. Earlier this year, you informed this committee that enough testing supplies would be distributed so that the states could test the recommended 2% of their populations per month. Yet, according to Johns Hopkins Coronavirus Testing Trend Tracking Center data, only about 20% less than 1% of their population per month. Has the administration been distributing supplies to states, and if so, why do you believe some states that have testing supplies are not testing more of their population?
So thank you for that. Again, before the full state plans were just received, and this was part of the PPP funding that we've reviewed, and we've reviewed them extensively with the CDC, we set preliminary targets for every state by phone calls with every single state, every single state health officer, epidemiologist. Overall, in May, the target was about 12.9 million tests throughout the country, and about 12 million were done. This is really very good considering many of the states tried to do 3 or 4 times as many tests as they'd done cumulatively during that time.
So you think we're on track?
I think we're really on track right now. It looks very good. Some states have underperformed, especially in May. Most of them have improved their performance in June. And our preliminary review of all the state plans, the great majority of them, I mean the overwhelming majority, were very good to excellent. So everyone is getting the message, and I look forward to that.
I thank you. And Dr. Fauci, if I can come back to you, when we first started this, you know, we knew it was going to be tough and that we're probably never going to get rid of this particular virus. But we talked about bending the curve and making sure our hospitals were ready. Based on your comments on PPE and face masks and so forth, I believe that you think that we're probably ready, maybe not perfect, but we're ready. And have we not bent the curve? I understand it's not over. It's not going to be over anytime soon. We've got to wear our masks and do what we're supposed to. But don't you think we've bent the curve and that our hospitals are now ready?
Well, I think so. We've been through a terrible ordeal, but right now we hopefully learned this lesson.
Is your mic on?
Sorry, sir. Yes, we've been through a terrible ordeal. We've learned a lot. The preparedness now is clearly logarithmically different than it was in the beginning.
And so we've bent the curve and our hospitals are ready. I yield back.
Thank you. Next, we go to